prolactin. I'm sure some people have heard of it or maybe even not. What is its, I guess, benefit or con in your body as far as how it works? Is it something that we need to be worried about when we're looking at blood work? What are your thoughts on it?
Yeah, so prolactin has two very different roles in both men and women. Well, it can have similar roles, which is it is really a hormone that promotes milk letdown or expressing milk out of breast tissue. And that's why it's predominantly, more of a quote unquote female hormone. Can have a very similar effect in men, and some men's gynecomastia can be exacerbated or brought on by higher levels of prolactin. And so that's why it is definitely an important marker to be looking at. So if you are prone to gynecomastia, usually people's mind goes straight to estrogen or estradiol. It's not always estradiol. There's other things that promote gyno. However, I think a more important role in prolactin is that in men, it is the hormone that brings down arousal after sex or after an orgasm specifically. So we have extremely high levels of dopamine during that aroused state, during that orgasm. And then, as most guys, it's referred to as that quote unquote post nut clarity, where as soon as you've had your orgasm, you are no longer interested. Guys will be wondering why the heck they were just looking at that on Pornhub, or, just want to roll over and go to sleep after they've had their sex. So that is really mediated by prolactin. That immediate shift is that production of prolactin. So you can imagine that if you had chronically elevated levels of prolactin, your libido would be completely suppressed. We would run into issues with erection quality and also refractory time, meaning the time between orgasms. So some guys will find that they can only go once, or they may not even be able to achieve an orgasm if their levels of prolactin are too high. So a lot of times I kind of tell guys that high prolactin masquerades as low testosterone. We see it a lot of times. Guys are convinced that they have low testosterone. They get their labs drawn. They see that their levels of testosterone are actually really adequate and perfect for ideal libido, but prolactin sky high, and that's actually the culprit.
Gotcha. And is there anything, first that could be driving an increase in guys, whether they're taking exogenous hormones or not?
There's quite a few things that can cause elevations in prolactin. Kind of starting from environmental exposures, that casein protein, the protein found in dairy, or also just casein itself for guys who supplement with that can impact the lactotropes of the pituitary and stimulate prolactin release. There's been some talk about gluten potentially doing that too. I wouldn't say that's just a blanket statement. Some people may be more susceptible to that than others. And you kind of have to do your own diet modifications to find out what is stimulating it for yourself. Another one more on the other hormonal side is TSH, thyroid stimulating hormone. If that is too high, that can also stimulate those lactotropes of the pituitary that produce prolactin. So a lot of times in hypothyroidal men who have elevated levels of TSH will also see elevated prolactin. They usually go hand in hand, very common. So again, it may just be actually the thyroid that is stimulating the prolactin, which is causing the libido. So you can see, again, these are multifactorial. It's not always testosterone. Your low libido could potentially be due to a thyroid disorder. And then your thyroid disorder may be due to other hormone deficiencies. And so, there's a lot to look into. And that's why I don't recommend just blindly starting yourself on TRT when you lose your libido. Some other things that could cause it would be maybe if you're literally masturbating or having too much sex. As we said, that's when it's produced. And so we will see guys who have porn addictions that will come in with very high levels of prolactin because they're masturbating a lot. They're having multiple orgasms through the day, and they almost by doing so are causing lower libido, which I think we all know. The more you have sex or masturbate, your libido starts to go down and down. So that would be another culprit. From a more pathologic reason, there are a lot of guys or people in general who will have like a pituitary adenoma, basically a benign growth on their pituitary that presses on that. It's also called a prolactinoma, and it causes an increased production of prolactin. Those, again, are usually benign, but those that are causing extremely elevated levels of prolactin may need to use some medications in order to lower that prolactin.
Gotcha. And I've also seen some, studies and things that indicate that chronic cannabis use could
Oh,
possibly elevate levels as well, correct?
yeah, I completely forgot both THC and then kratom, another one that's gained a lot of popularity over the past decade or so. It is similar to an opioid, will cause elevations of prolactin.
Yeah, absolutely. And I mean, anecdotally, I've even noticed that on mine in times when I've used cannabis more, that I will have slight elevations. So, and I've seen that actually across the board on other people's blood work as well.
Yeah, very
So,
common.
if you do find out that it's high, anything you can do to attenuate it. I know there are medications like cabergoline, but I know that that's not necessarily something that we like to use as a first line of defense with patients at Merrick.
Yeah, so few compounds that are essentially benign. I wouldn't say completely benign. Of course, nothing is completely benign, but would be P5P, which is the active form of B6. And I would definitely say use the P5P version because the unactivated form of B6 can have more detrimental effects like causing peripheral neuropathy. The P5P version, we don't run into that issue quite as frequently as just normal plain unactivated B6. Another one would be vitamin E. So I would say if you do see that your prolactin levels are elevated a little bit outside of that quote unquote normal range, so maybe we're talking 18, 19, 20 or so, that's the perfect time to employ something like P5P or vitamin E or a combination of both. I personally like to take P5P before bed. There are some studies showing that it improves sleep architecture. You'll see it included in a lot of various over the counter like sleep supplements for that reason. So P5P before bed can not only help to lower prolactin, but may improve your sleep quality. And then, yeah, you brought up the agents like, cabergoline, which I would tell people, don't mess around with those without the use or without being under the guidance of a physician. That's something that even myself in the past kind of blindly took. And it wasn't until I went into pharmacology in school that I learned it's one of the few drugs where there's a lifetime exposure limit. So they
Mhm.
tell us, you can't give over X milligrams in a lifetime because it can lead to cardiac issues. That's pretty scary. I don't like knowing that there is a lifetime exposure limit because that means that that drug is pretty damn toxic. So I would avoid that unless absolutely needed. And I would avoid that unless you're being monitored routinely by, say, your endocrinologist who is prescribing that for you.
Yeah, absolutely. And I've even kind of seen on some of the studies with cabergoline too, that they'll have guys that it makes them very impulsive, right? Because it's too much of a lowering of the prolactin by being a dopamine agonist. So it's, antagonizing or the prolactin, lowering it too much to where guys start, acting like they normally wouldn't, develop a gambling habit or chronically cheat. I mean, there's definitely a lot of things that I've seen that can be a negative with that. So yeah,
Yeah,
certainly don't run to that or buy cabergoline online as your first line of defense.
yeah, absolutely. I mean, on the forums historically, I remember that was something guys thought was a benefit. Like, oh, I can screw for days when I'm on Caber. Yeah, that dopamine is kind of unantagonized, just going insane, and you get that risk taking behavior. So yeah, you drive faster, you gamble more, you take bigger risks, you may cheat more. And I'll tell you from like life experience, you probably don't want to be doing those. Some having some governor on dopamine is definitely a good thing.
Yeah, absolutely.